In an emergency, we need help. And often, that urgent treatment can result in big medical bills, even with insurance. If a patient can't pay, eventually their medical bill could end up in the hands of a private debt collector. Especially now, after tens of millions of people lost their jobs in the pandemic and don't have money to pay their bills.
I don't think they should turn it over to collections, especially for people who can't afford it.
Barbara Kelso went to the emergency room 3 times in 2018 for an intestinal blockage. The pain so severe, she needed an ambulance. The 69-year-old had Medicare coverage, which paid for part of the ride, but the ambulance provider, Metro West, billed for the balance, $775. It was an overwhelming cost for Barbara, who lives off Social Security benefits and works part-time at Target.
If I were wealthy, I would have paid it in a flash.
Instead, the Beaverton woman agreed to make small payments with any money left over after paying for food and rent. In May, Barbara unexpectedly received notice she'd been sued. The ambulance company, Metro West, had turned her account over to a third-party collector. Wakefield Associates filed a lawsuit seeking to collect on the unpaid bill, along with interest and service fees.
I don't own property, I don't own a house, I don't own a car. I can understand if I were wealthy, but basically I have nothing.
After looking through court records, I found the medical debt collection company, Wakefield Associates, has filed more than 200 lawsuits in Oregon since early March, when the governor declared a state of emergency to address the coronavirus. Wakefield Associates didn't want to comment.
Maybe now's just not the right time to be banging on people's doors and trying to collect old debt.
Consumer advocate Charlie Fisher of Augsburg, along with other organizations, sent a letter to state leaders in June, urging them to temporarily prohibit all referrals to debt collectors and suspend debt collection lawsuits.
I think now is just absolutely the worst time for anyone to be collecting debt on people who are in really vulnerable economic situations.
Several states, including New York, Massachusetts, and California, have imposed restrictions on the collection of medical debt during the pandemic. Oregon's Department of Consumer and Business Services, which regulates debt collectors in the state, issued its own voluntary recommendations like accommodate debtors who have hardships and waive late payment fees.
I'm sure I'm not the only one. You're going to find a lot of people hurting because they can't pay medical bills.
Among the hundreds of medical debt lawsuits filed by Wakefield Associates in Oregon, court records indicate at least a dozen suits were against patients of Metro West Ambulance and its affiliated companies. Metro West declined to comment on Barbara's account or the lawsuit filed against her. The company provided a statement. We understand the medical and financial hardships that many are going through as a direct result of this pandemic. It has been Metro West Ambulance's long-standing practice to offer payment plans, financial aid, partial debt forgiveness, and many other options to those who require assistance to their medical transportation bills. Barbara is frustrated. She doesn't enjoy the same economic relief during the pandemic as others, like Metro West, which received a Paycheck Protection Program, or PPP, loan between $5 million to $10 million, according to government records. The loan, designed to help keep workers on the payroll, was one of the largest PPP loans in the state of Oregon. Barbara admits she doesn't have the money to pay for her ambulance rides. She never did. It was an emergency. Facing mounting bills in a lawsuit, Barbara said she had no choice. No one stepped in to help her during difficult times. She was pushed into bankruptcy. Kyle Aboshi, KGW News.